Apicha decided to move to and serve the community of Jackson Heights because it pretty much reflects the communities that we have been serving since 1997. Asian and Pacific Islanders, LGBTQ community, and people living with HIV/AIDS. Now what we would like to do with our cultural competence is see to it that we welcome those who are vulnerable immigrants to our services and also to our community centers so that there can be bridge building that can happen between these different communities and build a healthier and happier community as we begin to serve and provide services. Apicha's strategic vision is healthy communities, a future in which equity and equality are the norm. We shall dedicate our full commitment to this goal as we spread our work in this bustling melting pot, Jackson Heights, where people from the far reaches of the globe live, love, pray, and nurture their dreams for a better tomorrow.
We'll create a community health center. We'll provide primary care. And yes, we'll maintain our legacy population of HIV and AIDS patients and APIs, American Pacific Islanders, but we can also serve anyone who walks in the door.
Because what you are doing every day for people that are underrepresented, marginalized, and helpless is absolutely profound.
At the site, we have dental services, medical services for adults and children, as well as support services to help people get insurance if they need it, as well as to get on food stamps. We accept everyone, no matter their immigration status, their insurance status, or their ability to pay. We're here for the community.
We can't legitimately speak about ending the epidemics as long as communities like those here in Jackson Heights are left behind.
The work of Apicha and these partnerships are very, very critical because together we can let people know that New York City has your back and there is no room for discrimination, bias, and hate here in New York City.
There is truly no other community-based providers like Apicha and community health centers who truly welcome people regardless of whoever they are, regardless of what they have or not, and welcoming them in.
The people who work here at Apicha, the leadership, as well as the frontline staff, the board, and the facilities equals respect.
They go out there to the community, providing them the services, telling them that we are here, telling them that we care, and I think that that really speaks a lot to the spirit and the tenacity of the team.
And what makes me so happy about Apicha and to partner together on so many events across our community is that it's providing care and access to healthcare for our community in a language accessible, culturally accessible way, making sure to focus on our communities that are most underrepresented, making sure that in a historic LGBTQ+ communities like our own, that our LGBTQ+ community, in particular in our immigrant communities, are receiving the access to care they desperately need.
When we started this project, it was all about how we can provide healthcare services to the community of Jackson Heights and the neighboring nearby neighborhoods. So to make sure that the healthcare of our communities are improved. So this is a place where we do not turn away anybody, especially those who have problems accessing care because they don't have insurance, or they have language difficulties, or people who were marginalized by other healthcare systems. So we're here to help. We're ready. We have the staff. We have the space that, really accommodates the needs of our patients.